Lose the Boss segment tonight. There are reports all over the place that working Americans are having to pay a lot more for their health insurance under Obamacare. So we asked Lou Dobbs to look into this, and here he is. What is the headline?
The headline, Bill, I would say is Obamacare, whatever else you want to call it, Affordable Care Act, it is not socialized medicine. Folks, it's not socialized medicine. This is the most upside-down, peculiar contraption that I have ever seen posing as public policy. You know, all of the ideologues on the left and the right who are just, so mesmerized by Obamacare. The fact is, can I give you just a couple of, I mean, this is fascinating to me. If you have an income of just about $32,000 a year, you're going to get a subsidy for $650, and then you have to come up with a premium cost for Obamacare. $30,000, a little over $30,000. You've got to pay nearly $2,200 in premiums for your government brought to you by health care.
But those people are not going to be able to afford that.
They can't afford it.
Right.
And as you
so the government's going to have to pick up the tab for them, right?
Well, the government's going to have to pick up a really big tab, because fundamental to Obamacare is this little, very obvious and much talked about fact, but people really haven't assimilated it. If they don't impose, the government, impose penalties forcing young people, and by young people I'm talking about between 18 and 35, to sign up for Obamacare, which they're going to be paying, any close to $2,000 a month, or a penalty of $218. I don't care how young you are. $2,000 versus $200. Young folks are going to go for $200,000.
$200,000 a month is $200,000 a year.
Yeah. Okay.
Now, say you're making $75,000 and you have your own small business in Toledo, Ohio, or Kansas, or Wyoming, and you're going to get a bill because you're at $75,000, $80,000. Right. Premium is going to go up, right?
You're going to skyrocket.
Okay.
Absolutely.
Let's say you employ 5 or 6 people, and you're responsible for their health care costs.
Right.
Are the costs for those people going up too?
Absolutely. And you're going to be, well, you've got a choice. As a small business person, you can pay a $2,000 fine and be out of the way. Typically, you're saving money. The federal government through Obamacare.
So if you pay the $2,000 fine for each person, so you have 5, that's 10 grand. Right. All right. Then you don't have to insure them.
You're out of the business. You're out of the
harm's way. So they have to find their own insurance.
Now they've got to find their own, and then they're pushed into: do I spend $2,000 for Obamacare, or do I spend $200 to pay off the penalty for not having Obamacare?
Okay. So all of this stuff is just making it almost impossible to understand it. But the bottom line is that Obamacare is taking money from people, Americans, working Americans, in order to pay for poor Americans to have health insurance. Isn't that what it's all about?
It's not just poor Americans. We're talking about healthy young Americans who typically would not, even if they've got jobs.
No. But the poor people who fall under a certain income, they're going to have their whole health insurance tab picked up.
Correct. That is absolutely correct.
Okay, that's what I'm talking about here. So this is income redistribution, whatever you want, social justice.
It's absolutely
what it is. But in the meantime, everybody else is in flux and chaos. People are losing Blue Cross Blue Shield. Aetna's out of the game. They have to find new insurance agencies.
Bill, every single promise that President Obama made campaigning for Obamacare 2009 and 10 didn't come true.
One did.
Which one?
You can't deny insurance for pre-existing conditions. That
fair enough.
Okay,
fair enough.
Thank you. Because we want to be fair here.
Absolutely.
Right. That is true, and that is a good thing. But I agree, this is pandemonium, word of the day.
Pandemonium, a great word of the day, but you know what else? It's government. Government isn't working. There's not one aspect of government.
All right, Lou Dobbs, everybody.